Hello, my name is Berlinda Tyler Jameson. I'm the president of Trinity Health Foundation. That's your foundation, and that's my foundation. As many of you know, Trinity Health Foundation's mission is a straightforward one. We secure charitable gifts and volunteer resources to support Trinity Regional Health System in its quest to save more lives. In essence, we exist for Trinity Regional Health System as it provides quality patient care, as it improves the health of the communities it serves, and yes, as it saves more lives. Saves more lives, those are more than just words. I know for a fact that Trinity saves more lives every day. I know that personally, I know that professionally, because Trinity saved my husband's life. During the next few minutes, you're going to hear from people whose lives have been saved or whose quality of life has been improved because Trinity Regional Health System was there, and because Trinity Health Foundation was there in support of Trinity Regional Health System as it saved more lives. I thank you in advance for sharing the next few moments with us. Trinity Health Foundation is about working with employees like Mary Bazzari, a long-term employee who ensures that Trinity patients receive nourishment every day.
June 29th, we were at a softball tournament in Colorado. We get a phone call from the Rock Island dispatcher saying our house was on fire, and it was pretty bad, and emotions were high, but we didn't know how extreme it was until we got a call from Darren's mother, who told us that they could see the flames from their house, which was a mile away. And, you know, he didn't say anything. He was in shock. He couldn't believe how bad it was. Sorry. He didn't really say anything. He just stood there and watched. We were all in shock. I don't think we really felt anything until we got into the house. When we came back from Colorado, we pulled into our driveway and we walked up, and the house was still intact, and it was right about here, and you could see that it was still standing but boarded up. So it didn't look as bad as we thought it was until we got actually inside and saw that it was rubble. The worst thing that came out of the fire was I lost all my baby pictures and my wedding album, and I have those memories, but I have no way of showing my grandkids someday all those pictures. Cheryl helped me fill out the papers for the crisis fund because I had no idea that was even established at Trinity. And she helped me walk through it and kept supporting me, saying, you know, Mary, it's not charity. They want to help you. You know, please ask. So she helped me fill them out and helped me get in touch with everybody over there, and it's been a blessing. When we received the money from the crisis fund, I had to go out and buy, you know, tennis shoes to go back to work. I had to go out and buy new uniforms. My kids needed tennis shoes. We had to buy bedding, silverware, towels, laundry baskets, hangers, everything you start over. I mean, it was basically starting from scratch because we lost everything in that fire. And it's just amazing how much support we've gotten.
Trinity Health Foundation is about sharing with our community. It's about sharing with people such as Mike Nelson and his mother Barbara. Mike, still in his 30s, suffered a debilitating stroke, and Barb became his caregiver.
We were in Arizona when we got the call that Michael was in the hospital and had a stroke, and he was in severely critical condition.
My blood sugar got real high, and it made me form a clot, and then went into my brain, and I had a stroke.
Mike specifically taught me about the fight after a stroke. There were months where the family, Mike and Barb especially, did not know if Mike was going to make it.
I look at him and I admire him so much, and I am so proud of him for everything that he has accomplished, because he has beat just incredible odds.
When I started working at Trinity, that's when I got motivated to bring stroke camp to the Quad Cities and to Trinity.
I didn't know what to expect from stroke camp, and I was pleasantly surprised that it was so well planned and so well organized. I mean, they just treated me like a queen. The whole time I was there, I couldn't take care of Michael. They did the food. They actually, got him in and out of the room, got him in and out of the golf cart to take him all around the facilities. And we just it was so relaxing, and we had the great time. I mean, it was just so carefree the whole weekend. I mean, it was just a wonderful experience.
When I think about stroke camp, I think of a summer camp. And when I think of summer camp, I think of bonfires, camp songs, arts and crafts, fishing, and that's exactly what stroke camp has to offer. But what is unique about our stroke camp is that many of our campers and participants have residual cognitive or physical deficits from a stroke. And so many of our activities are tailored to meet the needs of those individuals. And along with all of the fun that we also have many opportunities for education on stroke, which is very important, as well as the support, the emotional support from one another.
If I could thank everyone that helped get us to stroke camp, I would love to say thank you. And it was a very wonderful experience. I had a very good time, and I learned a lot, and made a lot of new friends, and came out a lot better person than when I went in.
Trinity Health Foundation is about caring for our patients, for patients such as Dr. Bill Brandes, who could be your neighbor or your brother. While a physician and a specialist for Trinity, he entered our emergency department hurting and scared.
After I had tried to eat and it didn't work, and it didn't get rid of the heartburn, I knew that this was something bad, and that this wasn't something I was going to be able to treat on my own. The most likely cause for my dissection was I had run out of my meds and I stopped taking my medication for my high blood pressure. So I walked down to the emergency room. I went in through the back door and walked up to the nurse's station, talked to the charge nurse, and I told her that I didn't feel good, something wasn't right. And she said, "You don't look good, and we'll get a room for you." And that's when I called my wife and my mother. And I remember being a little scared then. At that point, they handled things very quickly and very professionally. My blood pressure was 225 over 125, and they got labs drawn and started me on some medication to lower my blood pressure. They started an IV and put me on those medicines. Then they ordered the CT scan.
Bill, it looks like you have an aortic dissection.
Okay, I figured that, so.
Yeah, so we're gonna need to send you to either Iowa City or Mayo Clinics.
Because it really was life-saving. I mean, there's no way to phrase that any other way than they did save my life.
I just hope that the employees of Trinity realize what a great foundation this is, and that they give as much as I hope to give this year.
They're not within the hospital anymore doesn't mean that they're still not our patients. So I would say that the foundation cares for our community, cares for our patients.
At this point, a big part of the reason I'm here is because of the emergency department and the support provided by the Trinity Health Foundation.